welcome. I'm just going to kind of give an overview of assisted livings, of what we have, because there's such a variety in our state as far as the assisted livings that are actually present. So what we do is we have the assisted livings, and they are about 170 of them in the state. We keep having new ones. I know here in Rapid City we had a couple new ones open up this past year. We've got a new one in Sioux Falls, and we get a lot of inquiries throughout the time, and so we want to make sure that they're in compliance with the 4470, which is the regulations, and their state regulations is what. We survey them to make sure that they're in compliance with the regulations that are actually out there. In an assisted living, it's not skilled care. So when you're thinking about skilled care, it's when you need maybe physical therapy, occupational therapy, or something like that. But that doesn't mean that those type of providers, such as a home health agency, cannot go in and provide additional care while you're living there. So in the assisted living, they're basically providing assistance with your activities of daily living, such as dressing, personal hygiene, supervision of the medications, or they assist you in giving the medications, because sometimes, as we had heard from Kathy earlier, some people have cognitive impairments of dementia and they don't remember to take their medications. And so that's what the staff are there to actually be doing, is to help with that. What we have on the is called optional services, and each assisted living, like I said, is so different and unique. There are 10 different actual optional services that people can sign up for, the providers, and pretty much everybody has medication administration. If they have cognitive impairment on their license, what that essentially means is that if you have someone who's got the dementia, the requirement is actually to have door alarms on those exit doors. Because if somebody should go outside and wander, we want to keep them safe. And so those door alarms do get a little noisy when you're in the assisted living, because they should be alarmed. They should be making sure that the staff are aware when those residents are going outside. So it's really a good safety feature. Physical impairment, what that is we want, if you have that on your license, then there's a requirement to have a call system. A lot of times you're used to the old call system that was on the wall that you pull, but nowadays a lot of the providers have more of the pendants. And so that if you were the one who's living in that assisted living, you can put that pendant on or put the light on, and somebody is going to come and assist you. Incapable self-preservation, that's more when you get to maybe the late stages of the dementia, the Alzheimer's, where you're not able to make a good sound decision. If the fire alarm went off, do you know what to do? That would be incapable self-preservation, if you would not be able to save yourself to get out of that building in the event of a fire. Oxygen, some facilities don't even have that on their license, but it really is a requirement. And these optional services, each of them have different components in it. We're training, and that training needs to be done to the staff so that they know how to handle oxygen safely. That you don't have a resident there who has oxygen on and they're smoking. What are they doing about it? Because it's a fire hazard, it's not safe for that individual. Therapeutic diets, if you happen to be in an assisted living that has this on there, the requirement is that they have, if you're a diabetic, they should have a menu to spell out what type of foods that you're going to be getting if you're a diabetic, so you're being served appropriately and so forth. There's also the requirement then that they would have to have a dietitian on staff, and that dietitian should be doing an assessment at least quarterly on each resident that is on that therapeutic diet, so to have that. Hospice is another one. I'm also the public health advisor, not only for the assisted livings, but home health and hospice care. And so hospice care is something that came about 2.5 years ago, that we included it now in the assisted living. So once you're there in that assisted living, if you're getting towards the end and you need to get that hospice care, they need to have it come from a certified hospice provider. Dining assistance, when you get more of the late stages of the Alzheimer and you're not able to feed yourself anymore, this is where they can have trained staff, either a certified nursing assistant or someone who's been through the dining assistance program, and they would be able to feed your loved one and help them with that. And the other one is the two-person assistance. And quite honestly, there's only a few providers in the state that have the dining assistance and having the two-person assist on their license because of the additional training and they also have to have a registered nurse on staff a minimum of 32 hours a week. And so there's those requirements that they do have. Some of the requirements when you go into an admission into an assisted living is different, and you also have to take into consideration some of our assisted livings also have what's called independent living. There is no regulations as far as independent living, and so it's kind of a fine line, but the independent living, you should be pretty much independent. Whereas if you're in the assisted living, you need that extra care. So there's always an admission agreement, and so if you're looking for a place, you want to read what that admission agreement says, because sometimes they set up standards of what they want, different policy and procedures of who they're going to accept, who they're going to retain, and looking at that. Resident rights, we're in the United States, everybody has rights. And so your same rights that you have living out is the same thing that you're going to have in that assisted living. And some of those residents' rights is privacy. I mean, Marty Jackley talked this morning about our privacy. If you got into that presentation, you still have those same rights in an assisted living. Privacy, confidentiality, quality of life, there should be nothing different with your life. You should still be able to do everything that you did in your own private home. You should be able to do in that assisted living as well. Spiritual program and an activity program are some of the other requirements. And I'm not mentioning all the requirements. These are just some of the top ones. But your life should not change just because you've moved into an assisted living. 3 meals a day is a requirement. Linen and laundry that should be being provided. One of the safety features that we do have and want them to do at least on a monthly basis is to conduct a fire drill. When we go out and do our surveys, we actually have our life safety code engineers, they conduct a fire drill. And we watch the staff to see if they know what to do in the event that there actually was a fire. So to be everything, make sure that everybody is safe. Staff training, like I said, with those optional services, there's different components as far as like with cognitive impairment. They should be getting some kind of training to know how to handle and work with individuals or communicate with individuals who have cognitive impairment. They should be able to do that. Some of the other training we have is again, the resident rights, the privacy, confidentiality, infection control, because that's a big thing that is out there. We want to make sure that we're not spreading any kind of infections or anything in the assisted living. So those are some of it. Tuberculosis, influenzas, and pneumococcal vaccinations, that's something that facility should be looking at to making sure that everybody is up to date on your vaccinations when you actually go in. And the tuberculosis is another thing. It's required upon admission that they do have that. Another thing that is required, and it's with all assisted livings, is they should have a pharmacist on contract, because that pharmacist needs to be looking at the overall picture. What diet is that resident on? What laboratory work has been drawn? If you're on a thyroid medication, there's required laboratory work for that, or if you're on Coumadin, warfarin, same thing. Making sure, and that pharmacist should be reviewing every resident on a monthly basis to make sure things are working there. How do you find a facility? I get calls on this quite often. We do have on our website, which is the Department of Health, and if you just even Google Department of Health South Dakota, you'll come up to our website, because we have a list of the providers that are actually up there, the towns that they're located in, who the administrator is, their phone number, and so forth. We don't have posted on our website all the different optional services, because this neighbor right over here could provide one thing, and this one over here provides something different. So it's really looking at that. So we do have a couple links there on our website of how to find these assisted livings. If you're contemplating moving into an assisted living, or you have a family member, or you're searching for your parents, really what I encourage you to do is when you get to that assisted living, you want to check out what their optional services are. I get calls quite frequently. It's like, my mom is in X, and they're telling me she has to move out. And it's like, well, okay, it's probably because they don't provide cognitive impairment on their license, because it's an option if they want to have it or not. And so you really got to look at what it is. So when you go there, walk around. Look at what the staff are doing. How are they interacting with all the different residents that are there? How are the staff communicating with each other? That's really an eye-opener for you to kind of get a feel A lot of times they have either the administrator in your smaller facilities, and when I say our smaller facilities, we have one, some of our assisted livings are also located in nursing homes. Those beds are located there, but then we also have the standalone ones, and we range from 1 to 2 beds in the nursing home. Otherwise, our smallest assisted living, I believe, is 9 beds, and they go up to 135 beds, and each of them are so different. So you really want to look at what you're getting into and the size of it and so forth. Do the residents really know the staff, and do the staff know the residents? Do they know each other so that they can give that good quality care? When we do the survey and we go into a facility and we're talking with the residents, or we watch that staff interaction with them, we can tell if they know them or not, you know, and you're not just a number, which is a good thing. Look at the meals that's being actually prepared and served. What does it look like? It should be nutritious. It should be meeting all the requirements according to the food pyramid, My Plate, any of those. Again, if you're on a special diet, such as if you're receiving dialysis, you're probably on a renal diet. So are they able to implement that and provide that the way that it is? And like I said, just talk to the residents, you know, and go around, watch what they're doing for the activities. Just get a good feel there. Don't spend 5 minutes, spend as much time as you want there to really see how things are going there. What are those visiting hours within that facility? Can you administer your own medications? Because again, that's your right. And if you're competent and you know what you're doing, you should be able to do that. What are those services that are being offered, and what are those charges? Our department doesn't get into the charges, but everybody has an a la carte. And so if you want this and this, then you get 2 loads of laundry this week and every week, but if you want a 3rd one, it's an extra charge. Just really look at those costs when you're looking at that. Is there an activity calendar? And the most important thing that I always tell everybody, one of the requirements is in the assisted livings, it's in our regulations, and it's also, and a lot of this is good if you're also looking for a nursing home. A lot of the same information applies for either or, is what it is. But what are the last survey results? They are required to be posted, and they should be up on the board somewhere accessible for either the residents or you as a visitor, and you can ask to see those and look at those and read what it is. And because we do a documentation, when we get done with our survey, we actually send it back to the provider, and if we find deficiencies, they have to tell us how they're going to correct them, and that's what we call the plan of correction, and that's something that they should have posted up there. And everything is kept confidential when we write up our survey results. We don't say Mary Carlson, you know, that we don't identify them in there at all. We always give them like a resident ID number 1, 2, 3. And so forth. So everybody is kept as confidential as we can when we do write up deficiency reports, and so forth. One of the requirements in the nursing home is that we have to, on our website, post those deficiency reports on our website. So they are available for the nursing homes. There is no requirement at this point in time for the assisted living regulations to be posted. So that's kind of one of the differences there. The nursing homes, they have to comply not only with state regulations, but they have federal regulations that they have to follow. Whereas the assisted living, it's just the state regulations that they need to be in compliance with. Memory care, we have quite a few of our assisted livings actually have a specialized, what they call the memory care unit. There is cognitive impairment where you have the requirements for the door alarms, but then some of the facilities also have a secured unit or the memory care where it's just a little more safer and they should be providing individualized care. There's requirements that there needs to be a physician's orders to place your loved one within a memory care. They should have special programs that are provided to that individual so that it's more individualized. They need to do an assessment of the resident's physical, cognitive, and the psychosocial needs. There's life safety code, again, requirements within the memory care to keep them safe. And again, like I said, the specialized training. And most memory cares, it's also a requirement that they have an outside area. So there's a door where they can go outside and they can actually, if they want to be outside in the spring or work in the garden, type things. Some have built up little flower beds or vegetable beds, and they're able to do that. So keeping an eye on that. That's really just a kind of a quick overbrief. I do want to make the comment that we do take complaints because we do get them. If you have a concern on any of the assisted livings, nursing homes, any healthcare provider in our state, you can give our department a call and make that. You are always maintained as confidential because we do not give that information out as to who called, you know, and it's kind of our way. The other thing is the assisted living providers, if something is happening with a resident, they are also required to report to our office. So if you have a resident who has fallen and a fractured hip, we want to know what that facility did to make sure to keep their residents actually safe during that time. We work hand in hand with the Department of Human Services. They do have a booth downstairs. They do have some good brochures down there. I recommend to grab one of those. They just kind of updated them so that there's more information. But we have what's called the Ombudsman, and we work real closely with them in our surveys and all the different licensed providers that we do have. So they're a good, useful tool because what the Ombudsman is they're a resident advocate. And so they're there for you is what they actually are. Depending on the extent of what the complaint is, or if we're going in the survey and we find issues at the facility, because sometimes we have found where perhaps they're not handling the money of the resident correctly, or if we're questioning some verbal abuse or physical abuse, we not only work with the Ombudsman program and Department of Human Services, but we also work with Medicaid fraud. And so with the Attorney General's office and everybody else, we do all work together and making sure that our residents are safe. Questions? That's a quick overview. Yes?
I've had a number of my residents at times, when there was an issue, I mentioned to them about the Ombudsman, they didn't know there was such a thing. How do you currently make it available? We used to just post it on the wall, and we would need to know it was there. How do you make that apparent to your residents?
For the residents that are living in the facility? Or, I didn't hear the...
Residents and for their families, how are they made aware that they have an Ombudsman, that they can call that number?
That should also be posted. If you look around, and that's one of the things when we also go and do our surveys, we're looking for the survey results, we're looking for the license of that assisted living on the wall, and we're looking for the resident rights. They should be posted up there, along with how to contact the Department of Social Services or the Ombudsman program.
So you're relying mostly on family intervention for those who have cognitive problems?
You know, when we get a complaint into our office, it's from anyone. Anyone can make that complaint. It's not necessarily just family. I know one facility, it was somebody who ran the transit bus, and they kept calling us and saying, hey, this is what's going on. So it can be anybody. Just a good advocate. Other questions?
How do we find out if there are complaints against the
Call me. Trust me, I get a lot of calls, and actually, our department really has a good working relationship with the providers, all of our providers, and because we talk to other providers in other states and other healthcare workers, and they're just like, Minnesota's not nice, Iowa's rude, and they're like, no, we like working with the South Dakota Department of Health. I mean, it's a funny, it's amazing, but I do go into places and I get hugs. It's like, and actually there's a few providers that are downstairs of the assisted living community, and yeah, I got a couple hugs from them already, the home health and so forth. But the complaints, it's hard to know, but again, looking at the wall, and I have actually printed off, because if you call into our department, it is public knowledge, and we do print off the deficiency report. I would send it to you, and I have done that. I know one facility, there was quite a few complaints that we actually had at that place, and they wanted to put their mom in there. And so I visited with her, and I said, well, I will give you these, but I want to explain, so that they do know. You can call 605-773-3356. I also have an office here in Rapid City.
In regards to the mention you had made of the making aware of the results of your facility evaluations, is that just strictly your affiliates who have access to that, or is that somehow made available to families and to the patients themselves to review? Are they given like a password to access that, or how do they go about that?
It's posted, the survey results are posted, so they are available. And if you are a family member and you're going there and you want to go and make a tour, you just say, I want to see your most recent survey.
Okay, thanks much.
And they have to give it to you. Sometimes it's interesting because it's one of my favorite ones to write, because it's like it's such a simple deficiency that why can't you just post these? Other questions? And our website's pretty, I mean, it gets a little complicated. My contact information is also on there, and to do that, and to look at that. No other questions? They only gave me a half hour, we got 5 minutes. If not, thank you.